Hey everyone, it's Candice Roberts. I wanted to cover acne, so let's do a little bit of education covering this topic. There's tons of different reasons why patients can have acne. It can be a young teenager experiencing acne for the first time, going through puberty. It can be an older patient that's kind of hormonal, having these breakouts. Typically, that's along the jawline, menstrual cycle related. It can be from something called maskne. So patients that's kind of never experienced acne before, they started wearing these masks, covers the lower face. That mechanical friction on the area causes them to have breakouts. So most patients aren't washing their mask. They're kind of wearing the same reusable one all week. So our mouth is full of bacteria. You breathing that bacteria on that area, the mask traps in all that bacteria. So it's just kind of floating on that skin. Then you have this dirty material that's just rubbing back and forth. Your poor skin doesn't have a chance. So we have tons of different options to kind of tackle this problem, but we have to make sure we get that acne under control before it leads to scarring. I had some patients that initially seen me right when this pandemic started with these concerns of acne. We kind of got it under control and now it's okay. Other patients that's never received any treatment, they're coming to me now and like, Candice, I never had acne before my whole life. I started with acne with this whole pandemic and now I'm having scarring. So now I'm having to treat the scarring with getting the acne under control. It's kind of just spiraling out of control. So how do we target this? I have tons of different options. I don't need you to come to me and say, Candice, I want, this is my plan, A, B, C. No, just come to me saying, Candice, I need some help. And I will tell you a bunch of the tools that I have in my toolbox to kind of be able to tackle this issue. I'll start with just some of the basics. We have a ton of different chemical peels in my office, but a common one is the VI Purify. So patients that's having active breakouts, this is a chemical peel that I can apply on the face, on the chest, on the back, anywhere the body's having breakouts. It takes a couple minutes to apply, not very long at all, and then you'll have some exfoliation to kind of help kill that acne causing bacteria and help prevent some of the excess sebum production, so that excess oiliness that sometimes causes the breakouts as well. Typically patients peel around day 3 to 5 on this. Some patients have light flaking, others patients kind of sheet peel. It depends on the patient. That's a great way to kind of jumpstart it. Now, the next question I usually get is, well, how many do I need? Well, I don't know. Everybody's different. You might just need one treatment to kind of jumpstart it. Then I put you on a medical grade skincare line and it gets better. Other patients, they might need a series. So they might have to see me once a month, for 3 treatments. Kind of really tackle this, combining it with some medical grade skincare. I might even need a prescription strength skincare to kind of get it underhand. Now, chemical peels aren't your way to go. If you like, Candice, I don't want the downtime of peeling like days 3 to 5. I don't want that. I'm going to work. I'm embarrassed. I don't want people to know that I had something done. Okay, no problem. I have a ZO stimulator glow treatment. That stimulates the tissue to exfoliate, but it's an invisible exfoliation. So you're not going to have the sheet peeling. So I would apply it, like if we apply it today, it takes about 15 minutes to do the whole treatment. I wash your face, apply the peel, apply a neutralizer, wash your face again, then you leave. And then you wake up the next morning and your skin's glowing. Is it a drastic improvement where your scars are lifted and everything's so much lighter? No, it's much more subtle, but you also don't have the sheet peeling that comes along with it. But I don't want you to underestimate the power of this treatment, the stimulator glow, because it is a very powerful treatment. Now that's not in your toolbox if you're not feeling the whole chemical peel thing. And you might not be a candidate too. I also have laser and I have microneedling. So microneedling with radio frequency, different than just plain microneedling. This is a great option for active breakouts, but also a lot of my pitted scarring. So you'll have those texture issues. I have some beautiful scars to show you as well. This microneedling is usually done in a series. I create a controlled injury to the skin, and then I emit the radio frequency to allow more contraction. So this is going to help resurface the top layer, but also contract those scars deep down underneath. That's typically done in a series, and then at the end of it, I can actually do platelet-rich fibrin. So I can draw your blood, spin it down, collect the healthy growth factors, and then I can either inject it into those scars or I can just sprinkle it on top. So some patients, they need subcision. They need me to go under that tissue with, typically I do this with a cannula. You can do it with a needle as well, but you go under and you release some of the scar tissue that's pulled down to the skin. Inject that PRF and help the tissue heal naturally with your body's own stuff. It's not like I'm injecting other product in there. Like, this is your body's own good stuff that I'm injecting back in to help it heal itself. So that's another option for us as well. And then I have laser resurfacing, guys. I have very, very light laser resurfacing where it's just, a little light exfoliation a couple days after. Or I have really, really ablative stuff where I can pretty much take off that whole top layer. I can get you some drastic results in even just one treatment. Now with that comes a little bit of downtime. So for about a week, you'll be red, or if you like, I'm not into the whole downtime thing. I want the best results with the least amount of downtime. Okay, I have that option too. You just need to tell me which are willing to go result wise, how many times you want to see me, and what kind of downtime do you want to do with it? And we can customize a plan that works for you. Regardless of what I do in office, that's still just an in-office treatment. So if I get aggressive with you every time you kind of come see me in the office, but at home we're not doing anything maintenance, then it's not a waste, but you're not reinforcing it. So I need a little bit of extra help, guys. I need you to help me at home with that daily medical grade skincare, kind of filling in the gaps. One of my lines that I use is Zeo Skin Health. So we have a complexion clearing program. That's actually a great place to start. But I don't sell my skincare like whenever we go shop at Sephora and whenever we shop, CVS, Walgreens, whatever, where you just show up and you're like, I want to try that vitamin C. That bottle looks cute today. No, that's not how I do it. You come to me and we customize a skincare line. All of my patients get a paper and it's step 1, step 2, step 3 of how exactly to apply it. You check in with me every 6 to 8 weeks. We're taking pictures. We're seeing progress. I'm saying, look, I see this in your skin. I need to change it. We need to swap up this product, or this is too irritating to you. We need to readjust it. This needs to be driven by a provider. This needs to be driven by a physician, by a nurse practitioner, by a PA, someone who's licensed to prescribe, because sometimes you need that prescription skincare mixed into it. You need things like retinoic acid. You need hydroquinone. You need something a little bit stronger than just the baseline products. I also custom compound medication. So if patients are like, no, Candice, I don't want to put on 12 different products. Okay, well, let me make one for you with the best amount of ingredients that I can shoved into one product where you don't have to do a bunch of steps. There's tons of different options. So just let me know that this is something that you're interested in, and I could definitely help you. This complexion clearing program is a great way to get started. It's actually a 6-month supply of all of the products in there. So you'd have a cleanser, an exfoliator, and then a toner. Now the toner is a little bit less than a 6-month supply, but I'll tell you how to kind of cut the corners a little bit on that. And then a complexion clearing mask. So this, the face wash you would apply morning and night. The exfoliating polish you would apply every morning to kind of stimulate that cell turnover, get that new vibrant skin coming out quicker. Those complexion renewing pads that are in there, you can actually cut them in half to make them last a little bit longer. You would apply that to the face and the neck. That's gonna tone the skin. That's gonna help restore the pH. That's gonna help shrink the pores and pull out some of those impurities. And then that complexion clearing mask is great to do a couple times a week. Most patients think of, it's a complexion clearing mask, it's gonna dry out my face so much. No, not true at all. This actually restores hydration in the skin, but it's also going to help for all those active acne lesions that you have, or those blackheads, kind of help purify all those pores. And then, those pesky little breakouts that you get during the week and you're just so frustrated, you got to wear the mask and it's just making things worse. Okay, well, guess what? I got a secret. Wash your face And then with this complexion clearing mask, you put it on all your active little lesions, and then you wear your mask. So you have those blue spots of the mask kind of treating those active pimples while you're at work. So nobody knows because you have the mask on. You go wash your face after your lunch break. You put new little dots on all those active little lesions. And guess what? You throw that new mask back on. Nobody knows. Secrets, guys, secrets. That's how we can tackle this really, really quick. Some other pointers that I have is a lot of patients are using these disposable masks, which are great because they're like, Candice, I don't have to worry about cleaning the mask. I know you fussed me because I never washed mine, so I got these disposable ones. Well, you're halfway there. Good job because they're clean, but those disposable ones are very abrasive on the skin. They don't feel good. What I find in my patients, the most beneficial form of a mask is a silk mask. Guys, on Amazon, they have some that's like a 4-pack that you can get for like $20. They're not outrageous. I tell my patients, get the silk masks, buy them on Amazon to where you can get a little pack. Bring them all to work that day, and then swap them out during the day. Come home at night, you wash them, and then you go back the next day, you have 4 new masks. So you're changing every couple hours to where you're not wearing the same dirty one all day. Because let's be honest, it just builds up that bacteria and it just sits there. So you have to let your skin breathe. If you're not around patients, or if you're in an area that doesn't allow, is okay with not allowing the mask for a few minutes, take that mask off and let your skin breathe, okay? Another pointer that I have is pillowcases. Pillowcases harbor bacteria, so much bacteria. Plus, a lot of our pillowcases are just regular cotton, which is good. It allows it to breathe some, but silk pillowcases are even better. So get you a couple silk pillowcases, and like every other night, change out your pillowcase to where you're not sleeping on that dirty stuff. It'll be soft and smooth, so it'll decrease that friction on that area as well. I have tons of different pointers, guys. I know from personal experience struggling with this for a while, it's tough and it's frustrating. So if that's something you're interested in, let me know. I have tons of tools. Just book an aesthetic consultation and we can cover all the options in our toolbox, and you can let me know, hey Candice, I just want to go the skincare route. Hey, I want to do an aggressive laser. Hey, I want to do a peel, whatever that might be, and we can come up with a long-term treatment plan for us depending on what your goals are. All right, guys, so that's everything I had to share with you about acne. Hopefully I can see y'all soon. Have a good day.